So guys, prevalent bioethical issues. If you have encountered the term prevalent, when I say prevalent, meaning it's persistent, meaning it has been there for quite some time and then it has been existing for long. So when I will be talking about these bioethical issues, however, kindly take note that these are not the only bioethical issues that you will encounter. Right now, there's actually a lot, and we might be able to touch on some of them as we go along. And then during the discussion, if you feel that there's something that you would want to add on the bioethical issues, feel free to comment it here. Okay, you can place it on the chat box or you can comment it on the video. Okay, so one of the prevalent bioethical issues that we might be encountering still is your abortion. Have you heard of abortion, or did you know somebody who committed abortion? Okay, did you know somebody who committed abortion? Now, class, when we talk about abortion, kindly look at the definition that abortion refers to termination of pregnancy, okay, by the removal or expulsion of your embryo or your fetus. So remember, if you would recall your concepts in maternal and child nursing, when you talk about the embryo, what's the embryo, guys? Can somebody tell me what's the embryo? Yes? Anybody? There's two words to describe the embryo. What's the embryo, dear students? Sige na. Okay? Yes, Francis. Go ahead. Yes. Anybody who can tell me what an embryo is? Uh-huh. On chat. Yes, yes, go ahead.
Embryo, sir, is the developmental stage of a baby, sir.
Okay, it's the developmental stage of the baby before it becomes a fetus, before it even grows to several cells. No? Okay, what else? Other ideas from the group? Okay, so class, basically when you talk about the embryo, okay, your embryo is part of the fetal development process. So in fact, even before the fetus is being referred to as a fetus, you would have the term embryo, okay, which is found on the early developmental stage of your fetus, no, for that matter. And when you talk about embryo, the argument there usually, class, is when does life begin? Okay, it talks about the concept of when does life begin. Now, class, if you would recall your concepts in maternal and child nursing, when is the heart developing? When does the heart develop? Can anybody tell me? If ever you've discussed already in maternal and child nursing, when does the heart develop? Diba class, if you can recall, this is not really MCN, but simple biology. If you can recall, guys, by the time that the egg cell and the sperm cell would meet, there will be the formation of your, anong tawag na natin ng fertilized egg, dear student nurses? Your fertilized egg is referred to as, yes, go ahead, John.
Zygote, sir.
Okay, yes, your fertilized egg is referred to as a zygote. Tapos plus it will become your embryo, and then it will become your fetus later on. So plus, there are kasi advocates of abortion. Okay, may mga taong nagsasabi, sige, go ahead with abortion. But then there are people who would say na, no, don't do abortion because we should be pro-life. Okay, the argument plus is usually pro-life. Yung mga pro-life plus is anti-abortion people. And then there are those who stand by pro-choice, which are pro-abortion people. So pag sinabi nating pro-life, sinasabi nila na, ay hindi pwede, life yan. You are not supposed to terminate the life because after all, it's life. It's murder. Okay, murder natin siyang maituturing if I will abort a baby for that case. But then class, the question kicks in. When does life really begin? And there are people who would say that life begins by the time that the sperm cell and the egg cell would meet. There are people who would say that life begins by the time that the embryo is already replicating to several cells. And there are people who would stand that life begins by the time that the heart is already developed. If I would look at fetal development, guys, kailan nagde-develop ang heart ng fetus natin? Can anybody have a wild guess for that?
3 to 6 weeks, sir, after ovulation.
Yes. Yes. Okay. So class, as mentioned by your classmate, third week. Diyan pa siya plus sa third week, fourth week na nade-develop yung heart natin. And, okay, does anybody have an idea? When can you hear the heartbeat of the fetus? When can you hear the heartbeat of the fetus? Anybody? Sige na, kailan ko maririnig yung heartbeat ng fetus natin? Yes, go ahead.
8 to 12 weeks, sir.
Tama, guys, no? And with the available equipment with us actually right now, commonly, you can hear the first fetal heartbeat at around 12 weeks. At around 12 weeks. So, ano ngayon ang point? Why am I talking about this? Because there are people who would say na it's okay to abort before the heart is formed. And there are people who would say na it's okay to do abortion by the time that it's before 12 weeks kasi hindi pa naman naririnig yung heartbeat. Okay? Now, baka tanungin niyo ako, sir, when is the right time to abort? To answer that question, I would like to go back to the question, future nurses, are we allowed to do abortion in the Philippines? Are we allowed to do abortion in the Philippines?
No, sir.
No,
No,
sir.
sir.
Okay? So plus the big answer there is no. The big answer is no. However, I'm just presenting to you kung saan nanggagaling yung mga ibang tao at saka kung ano yung point of view ng ibang tao. So for them, class, okay lang abortion before third week, wala pa namang heart. Okay lang naman abortion before 8 to 12 weeks kasi wala pa namang heartbeat. Okay? So those are the different arguments, class, that occurs when it comes to your abortion. And when you talk about abortion, you would usually encounter two terms. You have, class, your induced abortion and then your spontaneous abortion. Magsimula muna ako, class, sa spontaneous abortion. As the term implies, dear students, when I say spontaneous, what do you think? Kusa lang nga ba siyang nangyari or may instrument na ginamit? Spontaneous. When I say spontaneous, did it just happen or there is an instrument used? Yes?
Pusa, sir.
Okay, kusa.
Kusa, sir.
Diba? Kusa, no? Kusa. Kumbaga, in Ilonggo, natabo lang gid siya. Wala kita may hinimo, natabo lang gid siya. Kusa siyang nangyari. That's why it's referred to as spontaneous abortion. Can it happen? Yes. As you are learning maternal and child nursing also this semester, you will come to realize that there are a lot of reasons for spontaneous abortion. One very common example is your incompetent cervix. Okay, one very good example of the condition that could lead to your spontaneous abortion is your incompetent cervix. Okay, pardon my drawing with all due respect, ladies. So, if you will count my drawing, if this is your, okay, I'm trying to draw the uterus. Okay, that's your uterus with the fallopian tube there. Okay. So class, the opening here of your uterus, okay, in this part here where I'm drawing the circle, is actually your cervix. Diba, ladies, can you recall the anatomy? And also boys, ha? So your anatomy would tell you that the opening of your uterine cavity is your cervix. There are instances, dear students, wherein that cervix becomes incompetent. In other words, the term incompetent implies na it's weak. Instead of it being closed, continuously open siya. And what happens? The tendency is that the baby would fall, the fetus would fall along with the placenta. And that's why your mother would have spontaneous abortion or miscarriage. Okay? So class, another term for spontaneous abortion is miscarriage. Okay? So, kaya pag sinabi natin na, uy, may pasyente ako sa hospital abortion, don't right away think that that patient of yours na abortion is nagpa-abort talaga. Because there are different types of abortion. And oftentimes in the hospital setting, what you can see is the spontaneous abortion. In other words, hindi naman nila sinadya na abort lang talaga. Okay? Now, another example of that is, di ba I told you, incompetent cervix. Incompetent cervix is one example. Another example, class, is blood incompatibility. But that discussion will be reserved already in your MCN. And another example is your APAS syndrome. Okay, class, you have what you call your APAS syndrome. I encountered APAS syndrome, class, when I had a patient na four times na siyang anong tawag natin in Ilonggo? Nahulugan. Di ba? We use the term nahulugan. Na, 4 times na. They are attempting to make a baby. It's already 4 times. Natingala gid sila nga, they were unable to make one. And then it turned out that she has a rare problem referred to as APAS syndrome. Okay, APAS class is an autoimmune problem. So meaning class, it's already in your blood, it's already in your immune system. So it needs a lot of intervention for the problem to be addressed. Okay, so why am I emphasizing those examples? Just to remind you that when I talk about spontaneous abortion, it's related to a medical condition. Hindi siya sinadya. Kusa siyang nangyari. But in contrast with that, you have the term induced abortion. So pag sinabi kong induced abortion, that people who go to other people, or hindi ko naman kasi sila matatawag na professional, yung sa Ilonggo, yung tinatawag nating paltera. Have you heard of paltera? Okay? Yung mga somewhere along the dark streets kung saan pupunta ka, tapos magpapa-abort ka, okay, pupunta ka lang doon, magpapa-abort ka, and then you open your legs wide open, and then they will insert some instruments there to destroy the products of conception. So you refer to that one as induced abortion. Other than that class, you also need to know that there are medications that can cause your induced abortion. May mga medications po tayo that can cause induced abortion. Okay? Sa mga nag-iisip dyan, okay, I hope you're not, pero class, it's not advisable to use these medications and to have your induced abortion. Okay? So that's it. Main point that I would want you to take note is that when I talk about induced abortion, it would already entail the use of instrument, so instrumentation, or you also have the use of your chemicals, that would be your drugs or your medicines. Okay? Now guys, what I have noticed is that the condition abortion is becoming more rampant as the age gets younger. So what I mean is that I'm noticing in the younger generations, mas marami akong nakikilala na nagpapa-abortion. And you know what, guys? It does not usually end well. Dear students, it does not usually end well. So allow me to grab this opportunity just to remind you to be responsible of your sexual practices. Okay? As your age right now, if I can tell you not to engage in sexual practices, okay, with your partner, I will be happy if you will be able to abide with that. Guys, for those who are actually seeking it, I could not blame you. There are some reasons why you are seeking sexual activity. But if you are not yet engaged to it, better not engage yourselves to it. Okay? So if you are engaging to it, please practice responsible, think of responsible parenting and think about reproductive health. Okay? What I usually tell my students is do not do something wherein you cannot be responsible of. So kung may mga kakilala kayo, you know what, there are students who would approach me, sir, nagpa-abort ako. Or there are students kasi who would tell me, sir, my friend is planning to do abortion. Guys, as a nurse, I'm not inclined to advise you to go towards abortion. Okay? But then, dear students, there are those na tapos na magpa-abort, magtatanong kung anong gagawin. So you can still go to the hospital. However, if you are planning to do so, please do not. Please do not. With our Christian faith, with our culture here, and with your mental health that will be compromised by the time that you will make that decision, please do not. Okay? So please be responsible with your sexual practices. Agreed? Okay? Sa mga nagsasabi naman na, sir, hindi man po yung sexually active, okay, keep it as is. Okay? Keep it as is. There's a good time for that. Okay? And good timing will give you, anong tawag natin dyan, more happy results. Okay? If I may say so. Okay? So, in abortion, so you have your induced abortion and spontaneous abortion. What again I would like to emphasize is that if somebody will ask you, for example, nurses na tayong lahat, tapos sinabihan ka, uy nurse, can you help me? Di ba naturuan naman kayo kung ano yung gamot na pwedeng gamitin for abortion? What would be your answer? Will you assist in abortion or not?
No, sir.
No, sir.
Okay, give it a no. Give it
No,
a no.
sir.
Okay, give it a no. Yeah, it's easy to say no right now because we're having classroom discussion. But if you're talking to your friend, class, one thing that you can do is just allow them to verbalize. Usually, the aha decision to make or to do abortion is just out of emotions. So allow them to verbalize. Allow them to verbalize and talk and talk and talk. And then after that, refer them to the experts. Now, you can refer them to OB. You can refer them to psychiatrist for that matter. Okay? Do not ever assist in abortion because plus it would mean your license. Okay? It would mean your license. Okay? How about sir, ka-close friend ko gid siya, kay best friend gid kami, kay gusto ko talagang siyang tulungan na magpa-abort. Guys, think it like this. You may be friends, but by the time that her life will be at risk because of what you have done, that might change a lot in your friendship. Okay, so if you're a real friend, guide your friend if what is the proper decision to be made. Okay, so that's abortion. Okay, one of the prevailing ethical issues right now. The next issue is euthanasia. Okay, I think you've heard of the word euthanasia. Okay, it comes from the word thanatos. Thanatos. Thanatos is actually, memory serves me well. Thanatos means death or killing. Okay, so euthanasia. When you see the word plus eu as in the EU, the prefix EU, that means mercy or good. That's why euthanasia means mercy killing. Eu for mercy, euthanasia for killing. So when I talk about euthanasia, it's the act of permitting death, okay, for the one who is hopelessly sick, injured, or individuals in relatively painless way. Okay? Plus, why did euthanasia become an issue? There was a time wherein a medical doctor in the US of A is offering the services, okay, for mercy killing. My time that I will try to search who is the doctor and share it to you. But there was this time class that the doctor would post, hindi pa usong social media nung time niya. Yung ginawa niya class is email. Nag-i-email siya that he is offering services. Okay? For example, parang yung advertisement is, do you want to die or do you want to rest in peace? Contact me. Okay? Parang ganun yung advertisement niya. And then it turned out that a lot of people contacted this doctor because they would want to put their life to end. They would want to put an end to their suffering. And along with that, you will have end-stage cancer patients. You will have patients with genetic problems. So parang naging sikat siya na serbisyo. But later on, it became an ethical concern. Okay, it became an ethical concern already. So if you will be asked again the question, as a nurse, will you be assisting in mercy killing? As a nurse, will you be assisting in mercy killing? No. Okay? Plus, we are clear on our role that we need to preserve life at all costs. And then we are also clear to our role that we need to protect the life from womb to tomb. That is usually how our instructors would remind us. Okay? Nurses care for lives from womb to tomb. Meaning, plus, by the time that the fetus is there until the time that the patient is dead already, okay, we care for all of these patients groups. So we never assist in mercy killing. Okay? But as you go along the concepts in nursing, you will come to understand that there is what you refer to as hospice and palliative care. Okay, there is what we refer to as hospice and palliative care. That's another in the field of nursing and medicine. These nurses, we also have hospice doctors. Pag sinabi natin class na hospice, okay, it's about end-of-life care. Okay, end-of-life care. And usually people or patients who avail of hospice care, okay, people or patients who avail of hospice care are those with terminal conditions. And halimbawa, yung patient na may cancer, na stage 4 cancer. Okay? Pag sinabi ko naman class na palliative, okay, I think you've tackled this in fundamentals of nursing. When I say class palliative, it talks about symptom management. When I say class palliative, it refers to symptom management. In other words, we cannot cure anymore the disease, but we can manage the symptoms. Okay, we cannot cure the disease, but we can manage the symptoms. That's what you refer to as palliative care. Okay? Guys, bakit ko na Okay, so as I was talking, guys, I was talking about hospice and palliative care. So again, I would like to say hospice is end-of-life care. And then when I talk about palliative care, your palliative care refers to symptom management. Okay, palliative care that would refer to symptom management. Okay? Mm, So, guys, it goes without saying na your hospice and palliative care is actually assisting the patient. Allow me to write it down again. Assisting the patients towards peaceful and dignified death. Okay, assisting the patients towards peaceful and dignified death. Oh, you might be thinking, sir, so papatayin natin yung patient. Hindi guys hindi ganun yung point. Okay? Allow me to give you an example so that you will be able to understand the context. Plus, if your patient is in the last stages of cancer, okay? Or baka sa inyo, may na-encounter kayong patient with cancer. Plus, ano yung common concern ng patient with cancer in the last days of their lives? Okay? Or sa mga severe stages ng cancer nila. Ano usually class yung common complaints nila? Can anybody tell me? Sige na, with your little nursing knowledge. Yes, go ahead. Unmute your microphone. Yes,
Hair loss, sir.
hair loss. Yes, hair loss is there. What else? Ano pa? Ano palagay nyo yung mga severe na nai-encounter nilang symptoms? Yes, go ahead. Feel free to unmute, guys. Feel free to
Sure.
unmute.
Shortness of breath, sir.
Shortness of breathing is there. Very good. What else? Else?
Weight loss, sir. Weight
Weight
loss.
loss is there. Yes. What else?
Vomiting,
Go ahead.
sir.
Unmute.
Abdominal pain,
Vomiting
sir.
is there. Abdominal pain is there. And now that you've mentioned pain, that's actually the symptom that I am waiting for. Plus, isa sa mga major that your patient experience is pain. Okay? Among the major things that your patient would experience is pain. They will complain of severe pain in such a way na hindi sila nakakatulog, in such a way class na hindi na sila makapag-function properly because of the severe pain. And that is where the clinical intervention would come in. Okay? Diyan class pumapasok si nurse, diyan pumapasok si doctor. And ano pong ginagawa natin? Upon the order of the physician, we give your pain medications. And one example, dear students, of your pain medications is morphine. Okay? One example of your pain medications is morphine. You're taking pharma this semester, right? You're taking pharma this semester. So students, pag sinabi kong morphine, your morphine is a very good, no? I can tell you it's a very good, okay, allow me to write the word excellent. It's a very good analgesic. It's an excellent analgesic. And pag sinabi ko class na analgesic, in other words, it relieves pain. Okay, it's considered to be a pain reliever. But morphine has a side effect. It has a major effect of respiratory depression. In other words, class, pataas ng doses ng morphine, yung patient mo will be at risk for respiratory depression. But you might be wondering, sir, bakit pa natin binibigay? Okay? Because what's the purpose? Because you would want to assist your patient towards peaceful and dignified death. In other words, class, okay, mamamatay yung patient mo with cancer, but we don't want as healthcare professionals that they will die with cancer shouting for pain. Okay? In other words, yes, they will eventually die. Sadly, they will die. We know that morphine will lead to respiratory depression. But to help them class towards the pain experience, morphine is administered and morphine is recommended. Okay? So sir, pwede pala kaming magbigay ng morphine to our patients. Guys, take note under the order of the physician. Because if you are reminded in your fundamentals of nursing, when I talk about administration of medications, is it an independent action or a dependent action?
Dependent, sir.
Dependent, sir.
Okay, so you have your dependent action. Okay, it's considered to be a dependent action. Okay, yan yung isipin natin. So hindi pwede tayo magbigay ng gamot. But then, I'm telling you that there is one specialty referred to as hospice and palliative care. And in hospice and palliative care class, in hospice and palliative care, you assist these patients towards peaceful and dignified death. Okay? that's the beauty of nursing, no? If I may say. That's the beauty of nursing because we have a lot to do for our patients. Next issue, and perhaps one of the most sensitive at this time is suicide. Di ba? Suicide. Okay? I'm so sorry if there are people here with concerns on mental health. Okay? And if this discussion might trigger your thoughts, I would advise you to consult an expert. Okay? Hindi natin, don't worry, hindi natin stereotype na hala, student nurse ka, magsi-suicide ka. Plus, it's not like that anymore. Okay? And as healthcare professionals, we should be more aware that this is happening in our current times. Okay? So when you talk about suicide, our book in ethics would define it as an intentional self-inflicted death. Okay? It refers to intentional self-inflicted death that is usually caused by extreme emotional pain, distress, and unable to cope with problems. So as healthcare professionals, we should come to understand that people don't commit suicide just for the purpose of committing it. Okay? There is a deep-seated problem why people are thinking about suicide. There is a deep-seated problem why individuals would even consider suicide. Right now, we are becoming more aware and becoming more conscious with mental health. And I am happy to know that, and I am happy to see that. So right now, dear students, if ever you are having problems with your mental health, you know what? You can go to the doctors, you can go to psychologists, psychiatrists, and seek for help. Okay? It does not make you less of a person. Kadalasan kasi sinasabi, hala sir, base hindi na ako pwede mag-nursing. Okay? Hala sir, hindi na ako base pwede mag-nursing kaya may depression ko. That's a wrong idea. Ha? Wala na yung problema kung may depression ka, kag-nurse ka, wala na yung problema. Are you getting my point, dear students? Okay? There's no problem with that. So if you know people, for example, who you think needs help, kindly advise them to go to experts, no? Your psychiatrist, your psychologist for that matter, because it is these people who will be able to help them. And if it is you yourself who is having the problem, I can tell you, you can go to psychologists and psychiatrists. Now, they will be able to help you. They will be able to determine whether you need medications or not. Okay? Now, ara na naman din ang notion. Sir, paano if I'm taking the meds? Baka isipin nila na buang ako. Okay? Plus, you're not. You are not. Okay? Taking that step actually to seek professional help is a first step for you to improve your coping mechanisms. Okay? There's a lot of things happening in the world, and it's very understandable if our mental health is being compromised. Okay? Are we clear with that? Can I get a heart react if you're getting my point on that? Okay? And now, since you are to be nurses, baka may mga friends kayo nung high school, tapos sabihin na, ay, yung friend ko si Paula, yung friend ko na si Lyra, they're taking nursing. Siguro it's, I can talk to them about my problem. Yes, guys, your friends can talk to you about your mental health problems. But I tell you that you are not yet professionals to handle them. Okay? So if they're talking to you, for example, a friend will text you, mambal nga, friend, daw, hindi ko nagid kaya. Or friend, daw, amo na ning mga last ko nga message sa imo. Okay? Di ba daw may mga gaamo na? Have you encountered that sometimes? Wala ka mo mga amo na mga friends? Di ba? So may ara, no? Or mambal nga, friend, I want to end all of this. No? Mga amo ng mga sinyales eh. Okay? Guys, hindi nyo paglangulanguho na maghambal nga. Sige friend, i-end lang na. Okay? Guys, basi mga end of, basi kumbaga class, they are about to end their life. And they might be asking for your help. Okay? We would usually say that suicide is a call for help. Okay? Class, suicide is a call for help. Okay? So, don't think of it na nagpapapansin na yung classmates niyo. So, anong gagawin niyo pag may na-receive kayong ganyang message? Kasi sabi ko, hindi pa naman kayo qualified professionals. Talk to them. Okay? Just talk to them. Keep them busy on the line. And then try to find somebody who can help them. If you know the contact number of the parents, go ahead. If you can refer them to the hotline of DOH, try to search on your Facebook. I'm also grabbing my phone right now. There is Mental Health Connect. Yeah, it's here. Mental Health Connect Plus is one of the services of Department of Health Regional Office. Okay, I don't know, can you see my phone? There. Okay, that's their page on Facebook. Just search Mental Health Connect. And then plus they have a hotline number there wherein you can connect to individuals who are willing to listen. Okay? So, know when to refer your friend. Okay? Kasi class, hindi pa kayo capable, hindi pa po kayo equipped to handle these individuals. And you might be asking, how about sir if nurse na kami, kagaya ninyo, kagaya ko? Class, in my end, as a registered nurse, if I have students like that, I would also talk to them and then refer them to an expert. As a nurse kasi, our expertise is not on that line. We have an idea on mental health. Okay, but our entry level as a nurse is not yet able to handle that. So refer to the expert. Pero later on, if mga nurse, psychiatrist ka na, there's a specialty among nurses in mental health. We have nurses who work in the mental health. Yes, you can handle those problems. Okay? At saka kung kayo naman guys, no, I know there are students, for example, aba si sir, yung slide about suicide, parang today lang yata na I'm trying to survive from this. Okay, if you are triggered by discussions like this, talk to the expert also. Okay, talk to an expert. It's understandable. It's understandable that. And another ethical issue is the determination of death. Plus, it comes to a point that, no, if a patient is lying on bed and then the patient has no pulse, the question that sets in is the patient already dead? Can I say that this patient is already dead? And that question plus is actually coming about from the technological advancement. Now, because of the advancement of technology, we are unable to qualify further whether this patient is already dead or not. So what happened? No? At the past, parang hindi klaro kung ano yung definition ng death. That's why organizations like this one, this is US derived, but they have the UDDA, the Uniform Determination of Death Act. So it says that death happens on an individual who has sustained either one, irreversible cessation of circulatory and respiratory function. And then second class is those with irreversible cessation of all the functioning of the entire brain, including the brain stem. So if you will recall your anatomy, your brain stem class is the respiratory center. Your brain stem is your cardiac center. So whenever these two functions are already ceased, in other words, wala nang pag-asa in the cardiac and respiratory functioning, and then plus also in the brain functioning, that is when we can declare that an individual is clinically dead. Okay? So those are the different ethical issues that we are encountering. And sir, yun lang ba ang ethical issues? Napakarami pa guys. Okay? There's a lot of ethical issues that we will meet along the way. And if there are ethical issues that you would want again to touch on, okay, you can mention it on the chat box or you can comment it on the video so that we will be able to cover it in our next discussions. Okay?